Good afternoon, everybody. I'm Brian Dayton, and I'm with the West Virginia Chamber of Commerce. I want to thank you for joining with us today for this webinar on practical tips for employers who may either have to set up a vaccination policy or are planning to set one up on their own accord. We're going to be joined today by Leeann Kaminsky, who's the Chief HR Officer of WVU's health system. Leeann has a ton of experience in putting one of these policies in place. Before I get to formally introducing Leeann, I wanted to give everybody a little bit of an update. I'm sure, as you're all aware, a bill has been moving at the state capitol. It was announced Tuesday, late afternoon, early evening, that would essentially cause a lot of conflict between federal and state law for employers seeking to put these policies in place. I can assure you the Chamber and several other organizations are very, very engaged in the process right now, both at the House and in the Senate, working on this bill, trying to stop it. We do have a sign-on letter. I would like to just take a minute and mention that to anybody. If you are interested in having your organization sign on to that letter, please send me an email at bdayton@wvchamber.com, and I can forward you some of the details for you to take a look at. The reason we've asked Leeann to come on is to talk about practical experience for setting up one of these policies. This is not a discussion on whether or not employers should put these policies in place, but more of a discussion for a learning opportunity for those employers that either have to do it via the federal mandates that are coming or are planning to on their own accord. So without further ado, Leeann Kaminsky is the Chief Human Resources Officer of West Virginia University Hospitals and West Virginia University Health System. West Virginia University Hospitals is a 690-bed university teaching hospital located in Morgantown, West Virginia. WVU Hospitals is a subsidiary of West Virginia Health System. The West Virginia University Health System, the state's largest health system and largest private employer, is comprised of 18 hospitals and has over 27,000 employees. Leeann joined the system in 2016, and since that time, she has led the integration of HR services across the health system, including standardizing and integrating all benefit plans, compensation, HR operations and administration, and policies and procedures. Leeann obtained her Bachelor of Arts in Communications from the University of Pittsburgh, we'll let that slide, and her Master of Arts in Human Resource Management and Industrial Relations from St. Francis College. Leeann, thank you so much for being here today and for being willing to do this.
Thank you. I know I'll never live that down with you, Brian. That's what happens when you grow up in Pennsylvania in a little town outside of Somerset County. So thank you so much for that introduction. I'm very happy to be here with you all today. And hopefully the information that I share with you will be helpful. It's been a crazy few months for myself and our teams here at WVU Medicine. And this is a great opportunity, I think, for me, number one, to share a lot of lessons learned as we have gone through this process of setting up a COVID-19 vaccination policy across our health system. Do you want to go to the next slide, please? I thought it would be good for those of you that aren't as familiar as others with WVU Medicine. As Brian said, we do have 18 member hospitals across our health system. We also have 3 managed hospitals. And as you can see on the map here, we are all over the state, including not only just in the state of West Virginia, but we also now have hospitals in Ohio and in Pennsylvania. Can you go to the next slide, please? So why consider mandating a vaccination program for COVID-19? You know, personally for us, we have seen the significant impacts that COVID has made on our community and for our employees. You know, we really felt it was important to protect the health and safety of our employees, and vaccinations really have proven to help reduce the spread of COVID. And we have seen that, you know, across the country in terms of other hospitals and health systems nationally that have gone forward with making a mandatory vaccination program in place. We have also seen a lot of employees, coming into the workforce, not only being exposed to patients within that are taking care of patients, but also getting exposed in the community, and then likewise exposing other employees within our locations as well. Next slide, please. I thought I'd share a little bit of some of the current statistics across the state. And I think this is pretty impactful when you think about, why you might consider mandating a vaccination program for COVID-19. And I think it goes to, why the president, had released a few weeks ago why the federal government is looking to mandate this as well. But if you just look at the current statistics in the state of West Virginia alone, these are as of Tuesday of this week. Only 50% of the population in the state of West Virginia has been fully vaccinated. West Virginia has seen over 250,000 cases of COVID, almost 4,000 deaths. There are currently over 9,800 active cases. Our hospitals have seen a significant surge over the last 6 to 8 weeks since early September, which has really put us in a huge crisis mode with taking care of patients. Our flagship hospital in Morgantown, Rubin Memorial, on a daily basis, we have over 100 employees, sometimes closer to 200 in the last couple of weeks, with employees being out due to being positive with COVID or needing to be quarantined because of being exposed to COVID. Next slide, please. Just some more statistics here. These really show you the hospitalizations that are currently within our facilities within WVU Medicine. We currently have over 800 patients that are positive with COVID that are hospitalized. Almost 250 of those are in the ICUs and over 170 are on ventilators. So this alone shows you that the disease is continuing to spread, especially with this Delta variant. And as an employer, we chose to mandate the vaccine to really help hopefully stop that spread, to help protect our employees and to help protect our patients. One of the things that we have heard from patients too is that, if they're in the hospital, they're asking, is my nurse vaccinated? And, we want to be able to tell them, yes, they are, and they're safe and ready here to take care of you, and you don't have to worry about that. Next slide, please. In a recent Reuters survey, more than half of the US companies had responded that they're planning to impose a mandated vaccination by the year end. And that was prior to President Biden's pending ETS for the vaccination mandate that he made on September 9th. And I will also say that the West Virginia Hospital Association supports vaccination mandate for all West Virginia hospitals. And when they had made that announcement in August, that is when we also had announced that we were going to put a vaccine mandate in place for COVID as well. So let's talk a little bit about policy development. Luckily, there are lots of resources that you can access online because there are lots of employers that have put mandatory vaccination policies in place for COVID prior to us. Lots of healthcare institutions, but also lots of other employers across the United States. So there's lots of references online, but luckily for us, we had already been mandating the flu vaccine for our employees. So it was a little bit easier for us to, put together a policy in terms of who everything's going to apply to and how we're going to work through that process. But anyone that may not have done that in the past in terms of, putting these types of vaccination mandates in place, it might be a little bit more difficult and you might need a little bit more time to research how you're going to put your policy together. So, one of the things that I think you really need to think about is, who is responsible for developing the policy. We work together internally through our HR team, through legal and other experts on the topic. And we did do a ton of research and due diligence to make sure that we were covering all applicable items. From the policy content, you really want to be specific in terms of what your policy summary and your purpose is, who you're going to cover under your policy. Is it just your employees? Do you have volunteers? Do you have students? Do you have contractors? We included all of those because any one of those individuals could be considered a healthcare worker in our organization. So employees, volunteers, students, contractors, and vendors they all are applicable to our policy. And I think it's also really important when you are developing your policy as well to make sure that you're including important definitions. So there's always a lot of medical terminology or other terminology that you want to make sure that you're defining in your policy so that when you're referring to something specific, that someone can refer back to that definition so they know what it covers. COVID, although we've been dealing with it for the last 18 months, there's still a lot of terminology and things that we want to make sure that, for every level of employee that they can easily understand the terms and definitions that are in the policy. And then with the policy text, it really is important to think about if you're putting in place a vaccination program, is that going to be a condition of employment? We did make it a condition of employment. So employees were notified that they would be required to obtain the vaccine. And if they did not obtain the vaccine by a certain date, that they would be considered to have voluntarily resigned from the organization. There are some other parameters around exemptions that I'm going to talk about in a little bit that I think you need to make sure that you're including. But it absolutely, for us, we have made it a condition of employment. Next slide, please. Okay, so the other thing that I think you need to think about is compliance and responsibilities. Things that you need to consider are who is responsible for the implementation and the compliance of the policy. Is that going to be, your HR folks, your legal folks? Is it going to be the local responsibility if you have multiple locations in your business? Is it going to be a centralized or a decentralized process? Because a lot of times, if you have multiple locations, are you doing things, the same way at one location as you would at another? I would certainly recommend that if you have multiple locations that you would utilize a centralized process. I think it makes things flow and streamline a lot easier than if you would have a decentralized process so that people don't get mixed messages in terms of what your policy is. Next slide. And then it comes down to the policy development in terms of the procedures. And so, with the vaccine requirements, I really think you need to provide a realistic timeframe for compliance, unless, of course, it's required by the federal mandate by a specific date, which we know is coming, but we don't really know, what that timeframe is going to be. I think the last OSHA order that we got, we had 12 days to put it in place. So, I think if you're thinking about policy development right now, this is one of those things you really need to be thinking about, what that timing is going to be. And then the vaccine administration itself, where and how would your employees get vaccinated? It was easy for us because, we're a healthcare institution and we had easy access to vaccines and we're able to set up clinics for our employees. But I would strongly suggest as a business, if you don't have access to it, consider partnering with a local healthcare provider. through WVU Medicine, we certainly would partner with businesses in the local communities to try to help support you in terms of vaccine administration. And I think the other really important thing is you really need to provide education to your employees on the vaccine, because right now there is so much misinformation available, depending on, what someone's personal beliefs are or what they've heard their cousin, sister, brother, whoever tell them. There's lots of misinformation out there about the vaccine. So really having reliable educational resources will be very, very important. Fortunately, we have had the ability to provide access to our employees with infectious disease experts. We've had Q&A sessions with maternal fetal medicine physicians. We've provided a wealth of education of information from the CDC, but education and constant education and communication, I think, is very, very important because people need to feel safe in terms of receiving a vaccine. And if they don't feel safe, you're going to have pushback and people fight it and not want to do it. And then you have the concern of, losing people that work for you that are really important and key to your operations. The next thing to think about is, how you're going to obtain proof of the vaccines. How will you receive that proof and track it for compliance? Because you're certainly going to need to do that. Do you have an employee health program and an employee health information system? You really need the ability to report on that policy compliance to your managers and your supervisors so that they know who's in compliance, number one, it helps with who you need to talk to about, getting information if someone's unclear on, what the vaccine pros and cons are, as well as if you have folks that are working for you that are completely opposed to it and are going to end up leaving the organization, you need to be able to plan for that. So, we have been having daily conversations with employees about vaccination and compliance and reminding them, to turn in their documentation. Because early on, when individuals were receiving the vaccine, especially within our clinics and our employee clinics, everything was tracked through the VAMS database and not through our employee health database. So we've had to go back and do a catch up of all of that documentation. And that's where most people in the state of West Virginia, their information has been tracked. And so, getting a copy of that vaccination card to ensure that they have, completed it is really important. And making that process easy for your employees is really important too. So we have really gone out of our way to make lots of possible methods for people to submit that data to us for tracking, which is very, very important. Next slide. And next comes up the accommodations and exemptions process. When you put a policy like this in place, we have laws that protect employees and that we need to follow to ensure that we are providing reasonable accommodations, absent undue hardship, to qualified individuals that would have disabilities that enable them to perform their job duties. And that reasonable accommodation may include appropriate adjustment or modification of your policies, including a mandatory COVID-19 vaccination program. Next slide. Employees that do present with contraindications that are listed on the COVID-19 informational statement, they might be referred to their primary care physician for written approval prior to vaccination. And, these are some of the examples of contraindications to the COVID-19 vaccination. So folks that have had a documented history of a severe allergic reaction after a previous dose, or to a component of the vaccine, people that have had a documented history of severe allergic reaction to a component of each of the currently available vaccines, myocarditis or pericarditis after a first dose of an mRNA COVID-19 vaccine, and then also another medical condition that would require information in a separate narrative that would describe the exception or deferral into a future date is in detail. So an example of that might be, someone may have recently tested positive for COVID. They received the antibodies, and for them, they may be recommended to delay the vaccine versus not get it at all. Next slide, please. Accommodations and exemptions. So, the employer does reserve the right to take any necessary and appropriate steps, including imposing alternative COVID-19 prevention measures to ensure that the individual does not pose a direct threat to the health or safety of others in the workplace. So, for example, unvaccinated, asymptomatic employees could be required to submit to daily attestations that they are symptom-free and undergo weekly testing for COVID-19. So this is something that we actually have included within our policy, so that if someone is granted a medical or religious exemption from our policy, part of our policy to date does state that they would need to submit to daily attestations that they're symptom-free and undergo testing. Next slide. Which brings us to the religious accommodation. So, as an employer, we provide reasonable accommodations, again, absent undue hardship to employees that do have sincerely held religious beliefs, observances, or practice that conflict with getting vaccinated or receiving the type of vaccine that is currently available. We go through an extensive interactive process to make sure that we are determining the limitations of an employee's ability to comply with a mandatory vaccine and really look at exploring potential reasonable accommodations that could overcome those limitations. I would strongly suggest that you encourage employees to suggest specific reasonable accommodations. However, as an employer, you're not required to make the specific accommodation requested. You may provide an alternative effective accommodation to the extent any reasonable accommodation can be made without imposing an undue hardship on the employer or posing a direct threat to the employee or others in the workplace. As an employer, we reserve the right to request additional documentation supporting the need for an accommodation or request for any other exemption. And again, this is under Title VII. Any medical information obtained in connection with an employee's request for a reasonable accommodation, we need to be making sure that we're keeping those requests and that information in strict confidence. We have had internally within our organizations, managers wanting to know, is, this employee approved for an exemption? Are they not? We will not release information as to whether or not they were approved for a certain exemption. We will let them know if they have been exempted, but not for a religious or medical reason. We won't specify. And the only reason that we will do that, though, is so that we can ensure that that manager is making sure that the employee is going to complete the required attestation and undergo the weekly testing. Regarding determinations under the accommodations and the exemptions process, qualified individuals really need to be designated to make those determinations. When we set up our process for medical and religious exemptions, we put experts in that process to make the decisions. So for medical exemptions, we have doctors and nurse practitioners that are reviewing those medical exemptions. And then we also have an appeal process. The appeal process, we have a panel of physicians, anything from infectious disease experts, maternal fetal medicine, allergists, pharmacists that sit on that committee to review any denied appeals. We also have, from a religious exemption perspective, we have qualified individuals through our HR team, our legal team, as well as a religious exemption committee of individuals with religious backgrounds, directors of pastoral care, chaplains, and so forth, and deacons that sit on our religious exemption committee as well. We again have an appeal process for the religious exemptions as well. Should someone be denied, they have the opportunity to file an appeal, and then it will go in front of that committee as well. As an employer, we really should be making determinations about requested accommodations and exemptions on a case-by-case basis, because there's lots of different factors based on, each individual assessment of each situation of each employee. And the other thing is, when folks make these exemption requests, it's important to be timely, or at least give them a time frame on when they'll hear back from their response. Because, obviously this is a very sensitive matter to individuals, and they're wanting to know the answer of their exemption request or their exemption appeal. So we've really tried to communicate timeframes to individuals on when they would hear back from us, when we would make decisions. When we've requested information, we provide them with, we'd like to receive this information within 3 days. We also tell them, when they are filing an appeal, that they have 3 days to file an appeal, so that we can follow those timelines and parameters to make sure that people are getting answers in a timely manner. And also, like anything else, it's really important to make any determinations in a non-discriminatory manner. So again, with the accommodations and exemptions, things that you really should be considering is that the tracking of your documents, all of those forms and additional documentations that employees may submit, whether they're doctors, notes, excuses, religious letters from pastors, or written statements from employees about their sincerely held religious beliefs. All of those things need to be maintained in their employee health record. Again, having a timeline for submission of exemptions, I think, is really important. I also think it's important to try to review those and then provide your answers at one time. I have found that if you answer them one by one, sometimes you can get the message out where, how employees talk to each other, and they'll tell each other, well, I got an exemption for this, and someone might use someone else's reason. So we want to be careful, about how we're releasing information, so that you can make your determinations in a fair manner, and making sure that you allow enough time to review those. That certainly has been a dilemma for us, especially with the volume that we have received in terms of the exemption process. It takes a lot of time. A lot of times, folks, when they're submitting documentation, and you're doing a thorough review, you're getting 20 pages of documents of their beliefs, and you have to review all of that information to take that into consideration. And then, considering that time involved for the interactive process in case you do need to request additional information. We have found that on many, many occasions that we've had to ask for additional information to try to clarify, what an individual's sincerely held religious belief is. And so I think that's really important to make sure that you're providing enough time for that. And then in terms of your notification of approvals and denials, making sure that you have, tracked all of that, that you're providing documentation to that employee's employee health record. And then if you are denying it, making sure that you have appropriate reasons for denial and providing those reasons to the employee. And that appeal process, I do think it's very important, to have an appeal process in place, so that if someone feels that, their voice wasn't really heard the first time, they have that opportunity to come back a second chance, to be able to explain further their reason for the request of the exemption. So what you're seeing here on the screen is, this is one of many of our frequently asked questions. When we posted our policy related to COVID-19 vaccination, one of the things that we felt really important that we were going to do is, we thought about what are those questions that people are going to ask most. So we put out a frequently asked questions to our employees. It is something that we update on a regular basis, so that if employees continue to have questions, they have somewhere to go for resources and information. And then this way too, people are getting a consistent message. They're getting the same answer, that's posted online through our internal intranet. And they're getting the information that they need. The worst thing that you can do is to not communicate and not have answers, because that is when people get frustrated, as you know. So our FAQs have been updated on a regular basis. We have held town hall meetings with employees to give them ability to ask questions, and then we've taken questions from those town halls and used them to update our FAQs as well. And so when I think about lessons learned, obviously putting a program like this into place, we went full speed ahead pretty quickly. However, preparation and research prior to launching your policy, I think, needs to be really well vetted. I think you need to make sure that you're fully mapping out what your process is going to look like. Again, educational resources are so very important for employees, so that they have all the resources and education at their hand so that they can make an informed decision. Because obviously, getting a vaccination, it's an important decision. And, having folks consult with their physicians, I think is very important as well. And making sure that you have that educational information available for them is important. Updating and providing FAQs, and then understanding that, once this is in place, it's an ongoing process. And it's certainly, we are right now finalizing our appeal process for exemptions. And we know that we're going to continue to be going through this process because we're going to be hiring new employees. We're going to have new employees requesting for exemptions that we're going to need to review. We're going to need to provide them with the opportunity to apply for an exemption and to appeal it if it's denied. And so this is going to be a continuing, ongoing process. I think as long as this virus is around, and until we can wipe it out clean. And I think that is it for me, Brian. And I'd be happy to take any questions if anybody has any.
Well, thank you, Leeann. That was absolutely fascinating. Just to go ahead and let everybody know who's listening in, if you have questions, you can raise your hand right now and I can allow you to talk, or you can type your question into the Q&A box and go ahead and ask it that way. So there's a couple different ways. Let me go ahead and just pause for a second and see if anyone has a question. And also, Steve, if you'd like to jump in, please feel free.
I'll add my word of thanks, Leanne. Thank you very, very much. Not only was your presentation terrific, but the slides accompanying it made it so easy to follow. I just want to congratulate you on a terrific presentation. Very, very helpful information. And Brian, it looks like we have a question in the queue.
We do now. Let me pop it open. Actually, I can answer that. Will the PowerPoint be available to us? The first thing, this is being recorded. So once the recording gets into the cloud and we can download it, we will share it. Leann, I'll allow you to answer the other part of that if you just prefer people to go back to the recording or how you'd like to handle that.
I'm fine with you sharing the PowerPoint, Brian. Yeah.
Okay, well, thank you. What we'll do is for those people who may want the PowerPoint, just do me a favor, send me an individual email request and we'll handle it that way. And I'll get it back to you.
Yeah, the other thing that I would say is related to questions, if folks have specific questions and they don't want to ask in the webinar today, I'm certainly happy to take any calls or emails from anyone as well. Because like I said, this has been a tenuous process for us. And, as I told you, Brian, before, and Mark Carter, when we're going through this exemption process, and I thought to myself, wow, if, other organizations are going to be doing this, it would be really helpful if they had some insight as to, how can we operate and how can we put a policy like this in place, because it can get very overwhelming when you think about it.
So we have another question here, and actually a couple questions I'm going to combine real quick. That's two-part. The first is this now a condition of employment, proof of vaccination shown during onboarding? And how would you compare the COVID vaccine mandate process to your prior flu vaccination requirement or other requirements?
So yes, we do have it as a condition of employment. So our vaccine mandate is October 31st. I will tell you that we have over 92% of our employees that have become vaccinated already. So every day we're getting more compliance. With new hires that are starting after October 31st, they are required to either be fully vaccinated or be approved for a medical or religious exemption.
Thank you. Let's see, we have another question here. How will WVU Medicine adjust to the pending legislation? We addressed this at the very beginning when we opened up the webinar. The pending West Virginia legislation that would impact mandates. Leann, I'm happy to jump in if you want to jump in too on that.
I think obviously it depends on how it ends up, on how we will respond. But as of right now, we're moving forward. We're not making any changes to our policy or our program. Business as usual for right now.
Sure. And I'll just, for the benefit of the attendees, that is really gets to one of the heart of kind of our concerns with the bill that's pending in the West Virginia legislature, is that employment attorneys that were involved in the chamber's committees and very active with us have looked at this and really have some serious concerns that this bill pending in West Virginia would run into conflict with potentially current federal law, but most definitely the OSHA mandates that are likely to be here in the next couple weeks. The next question is, how do you handle discipline under this process? If you have a problem employee who won't get with the program, are there any special considerations you take in handling discipline up to and including termination?
So, so with this being the mandated vaccination policy being a condition of employment, our timeline goes through October 31st. If an employee does not does not become fully vaccinated by October 31st, what happens under our policy is they would receive a first level of corrective action, according to wherever they're at in the step of our process. So if they've never received corrective action before, it would be a first level. If they've had corrective action before, it might be a second or a third. If after that, employees do not continue to come within compliance, they still have an additional 14 days to become fully compliant. So, someone might say, well, after October 31st, how can you get 2 doses and be compliant? Well, you could, because you could get the Johnson & Johnson 1 dose. And we are making that available to employees in the organization as well, even though we've mainly utilized Pfizer across the organization, the 2-dose Pfizer vaccine. However, someone would not be considered totally out of compliance until the 14th of November under our policy. And as of the 14th of November, if they are not fully vaccinated, they would be considered to have voluntarily resigned, and they would be removed from our schedule.
Thank you. And the next question, what would be the process if there's a negative reaction to a vaccine by an employee that could be rather severe? What would they be covered under workers' compensation, or how would that be dealt with?
Yes. Yeah. So that all falls under our workers' compensation program. If somebody would have an adverse reaction. Yes.
Okay. Well, Leeann, at this time, I don't see any other questions. I'm just checking to make sure there are no hands raised and I'm not missing anybody. But I have, just for everybody, the benefit of everybody, I have typed in my email address to the chat. It is bdayton@wvchamber.com, so you can reach out to me. Again, Leeann, I really, really appreciate you doing this. This has been very, very helpful. I think we're all kind of in a state of limbo right now and awaiting federal regulations, but there are a lot of employers that are very likely going to have to be putting these policies in place, and others that have chosen to do so and are moving forward on their own. So this has been incredibly helpful. I can't thank you enough for taking time out of your day. I know you've been incredibly busy. And what we will do, just for the benefit of the attendees, once this recording is uploaded to the cloud, it sometimes can take up to a day, just depending on how busy Zoom is, I believe. We will get this added to our website so that you have an opportunity to go back and watch and learn. So again, thank you so much for this, and I hope everyone has a great day.
Thank you.
Again, Leeann, thank you so much. What a fantastic presentation and so helpful. Thank you.
Thank you, Steve.
Thank you. Have a good one.
Have a great day.